So do you have information regarding the length of hospital stay for COVID-19 patients now versus a few months ago?
Yeah, I really tried to get my hands on that. Unfortunately, it wasn't quite available yet. I did the last time I reported as we were, looking at the cumulative number or the cumulative cases that had been, discharged and had been coded and billed, so that we kind of knew, what was our revenue, what was our expenses, what was the average length of stay. And then I looked at it at a future time period, and it definitely was going down. And I think it's safe to say that if I had that most current information now, we would have seen it gone down even further. Because again, we're getting better and better at treating this virus. The use of remdesivir, dexamethasone, convalescent plasma. We are trying to avoid ventilation of patients, so putting them on BiPAP and CPAP and other types of breathing assistance, but also, detecting the presence of the virus very early on, treating them as quickly as possible. We actually have COVID patients that only stay a day. I mean, we've had one-day stays for COVID patients. And so we have a lot of them that, 2, 3, 4, 5 days. Although yesterday, I think it was, we discharged a patient that had been here 22 days. So we definitely have some of those longer lengths of stay, but I think it's continuing to come down. There are additional drugs that are coming out soon. I think maybe we heard about the monoclonal antibodies that were given to President Trump when he had the virus, and the studies show that it can reduce the length of stay and the severity of the symptoms. We're hoping that we receive some of that antibody treatment. It will be allocated and distributed by the federal government, so we're not certain if we'll receive any of that. But all of these things, I think, are leading to a declining death rate and shorter lengths of stay.